Hi, I'm Dr. Paul Magarelli from Magarelli Fertility Centers.
And I'm Dr. Dianne Cridennda, practicing traditional Chinese medicine at East Winds Acupuncture in Colorado.
So this is our third discussion on integrative reproductive medicine, and as you may or may not know, Dr. Cridennda and I have been doing research on combining traditional Chinese medicine with high-tech fertility in the form of IVF over the past 17 years. Our research has not only been published, but it has been used as the basis for what's called the CMAP protocol, the Cridennda-Magarelli Acupuncture Protocol. And this protocol is used around the world to enhance reproductive outcomes with IVF by combining a specific way of treating patients in an acupuncture fashion with specific points and at specific times, which Dr. Cridennda will explain in a little bit. But we have been able to demonstrate improved reproductive outcomes in the form of pregnancy rates, birth rates, reduction in miscarriage rates, almost the elimination of ectopic pregnancies, and actually a reduction in higher order multiples like triplets, quadruplets. This research spawned an industry, essentially. We both were co-founders of the American Board of Oriental Reproductive Medicine, Dr. Diane, of course, being the acupuncturist, and I played the role as advisor to the American Board of Oriental Reproductive Medicine, which is now a 10-year-old organization, over 10 years, with over 600 certified acupuncturists who have been trained in the combination of Western and Eastern medicine for the management of reproductive disorders. So today what I'd like to talk about, Dr. Cridennda, is maybe give us a little bit of a background as to what brought you to my office that one day many, many years ago.
Well, I had been working with other REs in Denver. There had been one study coming from Switzerland or Germany, Standard Victorian, and she is actually a neuroscientist. She's not an acupuncturist, but she has this passion for acupuncture, and so she did a study that looked at what happened when you hooked up electric stim to the needles, what happened to the uterine blood flow.
Okay.
And so what she found was by doing a certain protocol, it increased the uterine blood flow. By more blood flowing through the uterine arteries, it brought the IVF medications right to the ovaries to feed the follicles, meaning better absorption.
Perfusion,
Yeah,
better absorption,
exactly.
access
Right.
to the hormones.
Yeah.
Okay.
So I had one of your patients, and she recommended I touch base with you and talk about what I was doing. And so I made an appointment to come and see you that day.
Why were you interested at all in this area of fertility and acupuncture? I mean, it doesn't seem like a fit for acupuncturists.
Sure, and I thought I was going to be sports medicine, here in Colorado. Which,
the Olympic Training Center.
Yeah,
right,
which the fertility piece just fell in my lap.
Okay.
But also, I was a Lelatier League leader as a young mother and Prepared Childbirth Association. I was on that in Nova Scotia. So I had this affinity to families and building families.
And you have a family of your own.
I have a family of my own and grandkids.
Now, right?
So I was fairly new at this, and so
At doing
acupuncture,
Okay.
I think I'd only been practiced 3 years.
I see.
And so I kind of was a neophyte walking into your office saying, acupuncture can help. I had one little study in my hand, which was the Standard Victorian, which reported on uterine blood flow. And so that's kind of how it started.
Well, it's expanded.
Yep.
I would say that probably 9 out of 10 or 99 out of 100 IVF centers now either have on-site acupuncturists, have referral acupuncturists, or do their acupuncture with a non-referral, but an outside agency, and they don't. I know as a reproductive endocrinologist, when I first co-presented with you our data to the American Society for Reproductive Medicine, our national congress, I was the weird guy.
You had put your head on the chopping block on that one for sure.
Yeah. Well, and I sort of maintained, he's the acupuncture guy for many, many years.
Yeah, sure.
And then all of a sudden now we see this as sort of pervasive.
Sure.
And one of the many studies, many meta-analyses, which are studies of studies, have demonstrated that there is something about certain points and the combination of certain points over an extended period of time, meaning not just one treatment before, one treatment after, but by extending the treatment. Why do you think that's so? Why do you think doing like for example in ours we have multiple, and you can tell me exactly.
It's about 11 treatments total.
11 treatments. Why is that seem so important?
Right. Well, a good way to explain it is physical therapy. If you had shoulder surgery and you went and had one physical therapy treatment, it probably wouldn't be the same as if you had a series.
Right.
Right? You wouldn't have benefits.
They always recommend the series.
Right. We know that acupuncture doesn't stop when you take the needles, like the effects of the acupuncture doesn't stop when you take the needles out. It's changing brain chemistry and hormones and those kinds of things. But eventually we fall into that rut again. We go back into the same patterns.
Right.
Like with pain, we go into that pain pattern again. So by doing it multiple times, you tend to break that pattern, right?
Okay.
You
so
break
it's
that
cumulative.
pattern. Cumulative, yes.
Yeah.
And when I set up the protocol, I mean, one of the things you were really, clear on is, hey, I'm a scientist, I've done research, it's important that we use scientific research.
Did I seem to have an attitude about that?
No, but I mean, I get it,
Yeah.
because I was in Western medicine too.
Right.
So I kind of took the Standard Victorian protocol, modified it a little bit, and then if you remember, the Paulus
Sure.
protocol came.
That's the pre
where-
and post transfer, right?
Yes, like
Yeah.
1 hour before the transfer and 1 hour after. Well, what we found out was that study's a little antiquated.
Mm-hmm.
It was done in a hospital. The nurses were taught acupuncture,
Sure.
right? And so fast forward, here we are with more data.
Sure.
And in my mind now, and I've changed my protocol, is if I give you a treatment now, and then 1 hour later I give you another treatment, what does your body think? Am I supposed to do what she told me here, or am I supposed to do what she told me here?
Right.
So we had a strict protocol back then, and it was amazing and fabulous. And we're just trying to enhance it now by thinking through and looking at other research that did acupuncture during
Sure.
different parts. But I think that 11 treatments, and in our cortisol and prolactin study, we saw that the acupuncture helped the cortisol and prolactin go into a better fertile cycle
Mm-hmm.
on around the 5th or 6th acupuncture treatment,
Right.
which tells me that's accumulative, right?
That would make sense.
Yeah.
Now, from there, what happened? In other words, we were very strict about the protocol.
During the studies.
Some people started looking at there's even like a rare study that said it may have had a negative effect,
Mhm.
and of course acupuncturists have reasoning behind that.
Yeah.
But really the vast majority, and now there's I think at least 5,000 cumulative patients in these meta-analyses looking at the impact, and that impact persists.
Right.
And yet, why do you think today there's still some controversy?
About
Using it.
like
Using it.
using
You'll
acupuncture?
still find doctors that might be reticent. Now, I guess maybe I
Right.
should answer that, but
Yeah, I
Yeah.
mean, truly, I think most REs now, because of our work and because of your involvement in your society, I think most of them just really they understand it's not going to hurt. The acupuncture is not going to hurt, and I think you've told me many times you can kind of tell when people have had acupuncture.
Mhm.
They seem to take bad news better, they're more
Yeah.
calm, they respond better.
well, they're doing something for themselves outside. I think
Right.
Western medicine, we do things to people.
Right,
We do this to you. I
Right.
think with traditional Chinese medicine, it's a sort of a team approach.
Yep.
And you actually have to get the patients to participate.
right.
You know.
Right. And so when I work with my patients, I always want to know where they are in their cycle, because you're driving the boat right now.
Mm-hmm.
It's my job to enhance what you're doing. And if that means relaxing the liver, letting the energy flow a little better, keeping the emotions more calm. When our emotions are whacked out, we're not breathing, we're walking around
The fight or
stuck.
flight.
Yeah, we're stuck.
Yeah, so from a biochemistry standpoint, that's the adrenaline axis, the cortisol axis, the stress hormone axis.
Yeah.
So, some people will get, we're going to let the energy flow. They don't know
Sure.
what that means. But the
Right.
way I envision that is when you're tense,
Mhm.
your blood flow is completely restricted.
Sure.
Because you don't want, and the reason for that is is you're fighting, so if you get cut, you don't want to bleed out, if you think
Right.
about it physiologically. When you're relaxed, of course, it's much easier for blood to flow.
Right.
So if you can find mechanisms and ways, either through traditional Chinese medicine in the form of acupuncture or herbs, that can somehow deal with some of that
Right.
2,000 years of observational medicine,
Sure.
really, and experimental medicine, actually,
Yeah.
from a traditional Chinese standpoint, it seems to me that you're now complementing, or you actually may even be augmenting what I'm trying to achieve.
Right.
They may be resisting out of fear, and you're calming their fear. They may be clamping down their adrenals because they're confused or scared, and you're allowing that to release and not have those what could be toxic chemicals to pregnancy
Right.
circulating.
So when we're in fight or flight, we're not going to reproduce. We're just
Oh
not.
no.
And so I just had this thought, because when you think about the uterine artery,
Yes.
so when you check the pulsatility index,
Right.
if it's low, or
Right.
if it's higher,
It's an
It's a-
inverse.
it's-
The higher the number, the more constricted.
Right.
The lower the number, the more
so the
relaxed.
higher the number, it's constricted,
Yeah.
and it's tense.
Yeah.
And so if we're stressed all the time and we're going like this,
Yeah.
right? Whereas if we open our hands, we have a lot more room.
To carry.
And perhaps that's what the sympathetic parasympathetic nerve system is helping relax that uterine artery.
Mm-hmm.
That'd be a standard Victorian question.
Yeah, I sure
Yeah.
would be. So, from your standpoint, where are we today in the use of acupuncture? What would you tell the audience? How should they go about finding an acupuncturist? And if they do, what should they look for?
Sure.
And are there differences in types of acupuncture or types of acupuncturists?
Yeah.
What would you tell, the people listening in who could be anywhere in the world? What would you tell them?
Yeah, without getting into a lot of detail, there are very different styles of acupuncture. There's Japanese, but I would say anybody who's looking for specific fertility work, to go on the aborm.org, aborm.org, and you can look up in your zip code. They can look up in their zip code and find out who's there. So if they're ABORM certified.
So can I say what the word?
Sure.
ABORM is the American Board of Oriental Reproductive Medicine, right?
Yes.
Okay.
And that's somebody we've studied and taken extra courses and actually passed an exam. It would be like a physician who then becomes an OB.
Oh, so it's a subspecialty.
Right, subspecialty.
Okay. Mm-hmm.
So, and of course, we're not doing acupuncture now, but you can still connect. I mean, they can connect with me through herbs, and we just drop ship.
And how would they connect with you?
Well, they would go to my website, which is eastwindsacupuncture.com, and there's a little book an appointment or schedule an appointment,
Okay.
a little blue button, and it's a teleconference where I
Okay.
can do their whole intake, health history intake, and figure out those little fine things that are out of balance
Mm-hmm.
with the tongue, and then prescribe herbs specifically for their pattern.
So
not everybody's the
where
same.
are we at now, do you think, in the use of acupuncture and IVF? Or should we still study it? Are we done? Should we just accept it as like Clomid, accept it like IVF, just say, okay, you need this, at least. I mean, are we there, or do we have to keep asking the same question, does acupuncture actually help?
Yeah, I think there's enough studies out there that demonstrates that acupuncture does help, not only for fertility. For pain, like Medicare now is
Sure.
going to be covering acupuncture for
Mhm.
pain. With the opiate
Crisis, yeah.
crisis now, a lot
The
of
opioids, right.
opioid
Yeah.
crisis, a lot of the insurance companies are beginning to pay for it. So I think we're done proving ourselves. I mean, something that's lasted
Okay.
4,000 years, it tends to work.
And at least 14 years here.
Of course.
Okay. Well, thank you very much for taking the time, and I look forward to more discussions. And
Okay.
we'd like to thank you for joining us. We hope you're finding this helpful. If you have some suggestions for topics, we're absolutely happy to discuss them. You can connect with me at info@magarellifertility.com or Dr. Cridennda at info@eastwindsacupuncture.com. Of course, each of us have websites. Diane's is, as she mentioned, www.eastwindsacupuncture.com. Mine is www.magarellifertility.com, and you can sign up for telemedicines. You can ask questions. We love. I have free inquiries for folks who just have a 5 or 10 or 15 minute conversation with you about any topic you have related to fertility, sign up, and I'd be happy to get on the phone with you. I'll have to tell you though, I get up at 4 o'clock in the morning and they start at 5 a.m. my time, so make sure you figure that into your equation. But again, thank you for your time. Stay safe. We're here to help. We believe a healthy body is a fertile body, and stay tuned for our next episode. Thank you. All right, that's about 15 minutes.